So you work in the area of pre-implantation genetic testing, or PGT. And so I was hoping you'd tell us more about what is pre-implantation genetic testing.
So, before we kind of talk about pre-implantation genetic testing, it's a test that's part of a process with something called IVF, or in vitro fertilization. So, if it's okay, I'm going to take a step back and talk about what IVF is
Perfect.
and why somebody might be doing IVF to begin with. So, IVF, in vitro fertilization, is a process where we can essentially take sperm from a sperm source, egg from an egg source out of the body, put them together in a lab. Um, and create an embryo. An embryo will eventually turn into a fetus, which will hopefully become, a live birth child at some point. But that process is what we use to do that IVF process. And one of them includes for the ability to do genetic testing. And so when we talk about what pre-implantation genetic testing is, it's essentially a test that's done after we've removed egg and sperm, put them together to create that embryo. We let the embryo grow to a certain stage of life, usually about 5 or 6 days. And it'll have a certain amount of cell or little building blocks. Cells are little building blocks, and at that point, there should be different areas in the um, embryo. So some of them will become the areas that will form the baby eventually, the fetus, and some will be an area that will form the placenta. And that area is what we call the trophectoderm. And when we talk about PGT, there's 3 types of PGT that we're dealing with typically. Is another one, but I'm not going to go into it because it's not as standard as the other 3. One is PGT-A, A for aneuploidy. One is PGT-M, M for monogenic, and one is PGT-SR for structural. So typically, people who are doing PGTA are people who want to screen the embryo for common chromosomal differences. And the reason for that is we know that most losses in the first trimester um, are due to chromosomal differences that make the embryo non-viable.